All right. Hello and welcome, everyone. We're going to get started here. So my name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. Thanks for joining us again for another segment of Numbers with Nick. We're going to be talking briefly about the recent case activity that we've seen and kind of the direction that we're moving in the pandemic. And then we'll talk a little bit about the importance of the booster vaccines and the effectiveness of the booster vaccines on our case rates here locally. So with that, if you do have questions, you can always put those in the comment section below, and we'll try to answer some questions at the end of the video if we get any questions. Otherwise, if you're watching the recording, you can always submit questions to us via social media. With that, we're just going to jump into the content for today. So if you're watching the numbers, things are moving in the right direction. So what I pulled up here is one of the daily reports that we update every weekday. And if you've been on these live streams before, you're probably very familiar with this information. But essentially, we're taking a look at the number of total positive cases over the course of the pandemic in this graph on the upper left, total number of deaths due to COVID-19 over the course of the pandemic in the right, and then the estimated known number of active cases. So what we see here is that the numbers are starting to plateau a little bit in terms of the number of positive results. And this is the total number of positive results that we've seen over the course of the pandemic. What we don't want to see in this graph is a trend that moves kind of more or less vertically. We want to see trends that are very horizontal, very flat. That means that there's very little case activity going on right now. So as you can see, this is a little scrunched together because of the number of days that we're plotting data for. It's been almost 2 years worth of data on this graph, but essentially what we're looking at is we're looking at the most recent trend, so this tail and the right end of the curve, and looking at the direction. And you can see that as we're looking at the most recent numbers and the most recent weeks worth of data, that tail is starting to kind of curl there, and it hopefully will continue to show that trajectory. And that means that things are improving in terms of case activity. There's fewer and fewer new cases each day being reported to the health department. And that's a good sign. We want to see those numbers continue to move in that direction. The other piece of data that we are seeing is that we have seen a little bit of recent increase in the number of deaths due to COVID-19. And one kind of piece of information that I'll share on the stream today is that when we see our case activity change, either one direction or the other, we tend to see the hospitalization rate and the death rate follow the trends in the case activity rate and just lag by a few weeks. So although we may see some additional increases in our death rates due to COVID-19, these are likely due to some of the surge that happened earlier in January and at the end of December. So it's not an indication that there are more recent severe cases of COVID-19, but just based on the nature of how things spread and how many people who become severely ill end up in the hospital for an extended period of time. That's just kind of how the trends are working over the course of this pandemic. So just wanted to offer that as a little piece of information. As you're looking at these two data points, you may continue to see some slight increases in deaths due to COVID-19 while the case rates are falling. And just wanted to add that additional little piece of context. The other piece of information that we've tried to plot through the course of the pandemic is the number of active cases. Now, most recently, this has been a little more complicated in terms of reporting because of the wide availability of home test kits. So home test kits are not figured into our estimations of active cases, and that's because we largely don't know how many people are using home test kits and how many of those who are using those home test kits are testing positive. So what we do is we try to estimate the number of known active cases using those who have tested positive via PCR testing. And the reason I wanted to talk about this today is just to highlight the trends that we're seeing where it looks like we have kind of reached the peak of the number of active cases and are starting to come down based on when people are recovering from their illness and when people have tested positive. This estimate does tend to be a little bit high in terms of overestimating the number of active cases. But with the number of people who are testing positive with those home test kits, it very makes it a little bit more tricky to get a real accurate estimate. The important part is that we're kind of using the same measure that we've been using all along, and the trends are moving in the right direction. The other piece of information that I wanted to share on the stream today is just with respect to the number of new cases that are being reported to the health department and that 7-day moving average in terms of case activity. This is another metric, and I'm referring to this graph here in the middle of the screen, but this is another metric that we use when we're looking at the trajectory of new cases and kind of the trajectory of the pandemic. So you can see throughout November, December, and January, we saw a pretty consistent climb in terms of the number of new cases being reported to the health department. And since kind of the tail end of January, we're seeing pretty strong decrease in the number of new cases. And so this is not unlikely to happen in terms of if we have a very rapid rate of increase in case activity, we will also see a rapid decline in case activity. This is part of kind of the disease transmission dynamics, but as more and more people become infected very, very quickly, more and more people get over their illness very quickly, and there are just fewer people in the community to infect or become infected by the virus. So that's another kind of piece of information, some explanation of why we're seeing some of the trends that we're seeing is we had a really steep increase in case activity, and that's not unlike what we were seeing across the state of Wisconsin and also across the world with respect to the Omicron variant. So based on this information, I'm hopeful that we will see ongoing decreases in case activity, and we'll get to levels that we saw kind of in the summer months in 2021, where we're seeing very, very little case activity. Right now, I think one of the positive aspects of our most recent surge is that the Omicron variant seems to be causing less severe illness. So although we did see a lot more cases, a smaller percentage of those cases ended up needing to be hospitalized. Unfortunately, this has put a strain on our healthcare systems, and the levels of patients needing to be hospitalized kind of rivaled what we saw in the peak of 2020 in kind of November, December. So there was still a strain on our healthcare systems, but at this point, the numbers have decreased in terms of our hospitalized patient counts. And so I think that's positive news where we're starting to free up some of our healthcare resources, and there are fewer patients in the hospital getting care for COVID-19 than we've seen for the past couple of months. Right now, I think the most recent data I have is there were about 24 patients in the hospital on Tuesday getting care for COVID-19, which is a much lower number than we had seen just a few weeks ago. So positive trends kind of across the board in terms of our case activity and severe cases. So I think that's some good news, and I hope that we're moving in the right direction and we'll kind of remain low. It kind of remains to be seen. There's still the possibility of additional variants to develop as the virus continues to spread. It does offer more opportunities for new variants to develop, and so that's something that we'll continue to monitor. Right now, the case activity is moving in the right direction. So I wanted to switch gears a little bit and talk about vaccination and what we're seeing in terms of the outcomes among those who are vaccinated, boosted, and unvaccinated. So when we look at our case rates, our hospitalization rates, and our death rates, what we do is we look at how many people tested positive over a 3-month period. So we're looking at November 1st through January 31st. And we're taking those numbers and saying, okay, how many people tested positive? Okay, what portion of those individuals had received kind of the 2-dose series of the vaccine of Pfizer and Moderna, or the 1 dose of Johnson & Johnson? Those would be considered fully vaccinated. And I know this is a little bit confusing because you can get another dose of the vaccine and be known as boosted. So the terminology is a little bit confusing at this point, and there may be changes coming in terms of what's considered fully vaccinated. But right now, this is kind of the situation that we have to work with. So those are kind of the explanations of what those terms mean. But essentially, we look at who's testing positive and how many of those people are boosted, how many people had received kind of that original series of the vaccine only, but weren't boosted, and then how many people are not vaccinated or not fully vaccinated. And so what we see is we can compare across these different groups and say, okay, so when we look at the number of people who tested positive and were boosted, how does that compare to the total number of people who were boosted in Rock County at that time? And what we see is there's just under 1,100 cases per 100,000 fully boosted individuals in that 3-month period. By comparison, there were about 41 or 4,200 cases per 100,000 among those who are fully vaccinated, who had completed the original 2-dose series but had not gotten that third dose of the vaccine. And then comparatively, we can look at those who are unvaccinated and say that just over 21,000 per 100,000 unvaccinated individuals contracted COVID-19 in that period. So that just demonstrates the local data that we have access to and the effect of the booster dose in really preventing the spread of COVID-19. By comparison, there is much greater protection of those who are boosted than those who are unvaccinated. We can also do the same kind of breakdown for our hospitalizations and our deaths. And among those who are hospitalized, a very small portion of those who are completely boosted needed to be hospitalized due to severe COVID infection. A slightly larger portion of those who are just fully vaccinated but not boosted needed hospitalization. And a much larger portion of those who were unvaccinated and contracted COVID-19 had severe enough illness to be hospitalized in that 3-month period. So again, we're using this information to make these comparisons across these groups to really demonstrate the effect of the booster dose of the vaccine and the importance of getting the booster dose. For many people, you may be eligible for the booster shot. If you have questions about whether or not you're eligible, I encourage you to talk to your healthcare provider. We are seeing right now that our rates of people being boosted is about 57, 58% of the eligible population. So we have a sizable chunk of people who are eligible to receive a booster dose and have yet to do so. But we're seeing very strong evidence that the booster dose is going to prevent severe illness and really keep people out of the hospital and keep people safe from this virus. So with that, I'm going to close out the stream, and that's all I wanted to share for the content today. I'm going to check the chat box and see if there are any questions that have come through. And if you do have questions about getting vaccinated or locations in the community where the vaccine is being offered, you can go to rockcountyshot.com, and that provides you with some great information. Again, if you have questions about whether you're eligible for the booster dose, I encourage you to talk to your primary healthcare provider. So with that, it looks like no questions have come through. So we're going to close out the stream for today. Thanks for joining us, and we'll see you in a couple weeks.